Well, hello, it's Jenny D with my friend Dr. Kohli from 9 News and Cherry Creek Heart. And for Health Tidbits today, we're going to be talking about bedtimes and having that regular bedtime and the benefits, including blood pressure.
This is amazing. And as a cardiologist, I was so excited to see this data. But so if you think about how our body works, Jenny, it follows the sort of what's called a circadian rhythm, a natural variation in our blood pressure. So the few hours before we go to bed, we actually see a 10 to 20% decline in our blood pressure because that parasympathetic nervous system, it's called the rest and relax nervous system, starts to activate to get us ready for bed. And then somewhere around 4 a.m. to sort of 7 a.m., we start to see a spike in some of the hormones that can then lead to an increase in blood pressure as we're waking up. Because when we wake up, we're active, we're moving around, we need that higher blood pressure in order to do our activities. So looking at that kind of natural variation in blood pressure can tell us a lot about who's healthy and who isn't.
Okay. And how, is the variation linked to disease? How is that affecting us?
Yeah, so some people have you're supposed to have that nocturnal dip I talked about, 10 to 20%. Some people have a blunted dip. So that's the first sign that your blood vessels are not reacting normally to your nervous system and to your hormones. Some people can have an exaggerated dip. They go a little bit too far in the other direction. That's also a sign of disease. And some people actually have a paradoxical event where their blood pressure starts to go up at bedtime. Oh, wow. And that's kind of the worst. So in a way, the way that our body responds to night cues and our body's clock will tell us a lot about whether or not you're going to start to have disease with respect to blood pressure later in life. And if you think about blood pressure, we sort of blow it off, but it's one of the most important things because it's the pressure that every single organ is feeling. Your brain, your eyes, your kidneys, your lungs, your heart, every single organ feels this pressure. So having a nice normal blood pressure is really important in terms of keeping our organs young and healthy in the long term.
And why do you think having that regular time can improve the blood pressure? Just instead of being I'm going to stay up another hour or so and watch the final episode of this show or that show, it's better to have a regular time that you go to bed.
Well, it's funny you say that. So you mentioned most of us watch TV before we go to bed. And what does it do? It stimulates our retinas. It gives us light, which makes our brain think it's morning. So I talk about how, our body follows a natural clock of blood pressure. So that's one of the worst things that we can do. Then we go to bed at different times every day. So our body doesn't know when it's waking up, when it's going to sleep, because it thinks it's supposed to trigger bedtime at the same time every day. And we end up varying our bedtime. So when you're following a nice natural routine where you're following the same bedtime within about a half an hour, 45 minutes every single day, and you have good sleep hygiene in the sense that you're not stimulating those retinas within an hour of bedtime, our body really kind of goes into sync. So our nervous system loves that. Our hormones, our melatonin, our cortisol, our stress hormones, they love that. And our blood vessels really love that. So it's almost like they learn what they're supposed to do, and then they can kind of follow that routine. So in this particular study, they told people they can go to bed at any time they want, but it has to be around the same time every night, within kind of a half an hour, 45 minutes. And they saw a decline in blood pressure of 4 points over 3 points. That's about as much as starting an exercise routine or cutting down the sodium in your diet.
Oh, wow.
And it's associated with a 10% reduction in risk of heart attack.
Just by switching that one thing.
Just by doing that one little thing for your body, which is the consistency.
Yep.
So I don't want people to feel like they can't stay up late.
Yeah.
But at the same time, I want people to realize that when you go to sleep and when you wake up is really very important for your body's cues and your blood pressure.
Makes sense. And when should you go for the best? Go to bed.
So they've studied this. So if you go earlier than 10, it doesn't really have too much benefit, short of, giving you a few more hours of sleep. But if you're getting enough hours of sleep, the best window is 10 p.m. to midnight. After midnight, you start to perturb some of those hormones that I talked about. And in that 10 p.m. to midnight window, you want to be within 30 minutes each day of that time. So what I generally say is, let's say, what time do you have to wake up in the morning? Let's say it's 6 a.m. You count back 8 hours. 10 p.m. would be your perfect bedtime. And your window is 9:30 to 10:30.
Okay.
So if you shoot for 8 hours, count back from when you have to wake up in the morning, and then really put a half an hour on each side of it. That should be your window to go to bed every single night.
That makes sense.
Yeah.
All right.
Do you think you can do it, or?
Well, yeah. I think it could. My kids, I'm not sure, but yes. And that's the hardest thing I think as a parent too, is just trying to find that balance where, especially with when, like we wake up at 4:30, like have to get going.
Right.
It's like my window would be a lot earlier than mostly the kids' window would be, but they need more. But they need more sleep as well because they're children and they're running around and crazy all day.
But I think you're right. As parents and with all the work and emails and all the things we have to do in life, sometimes we feel like we have to pack it all in and we don't really have a choice. But the best you can do to optimize it, at least within a half an hour, I think it's really important. And then try on the weekends not to do, I like to binge on sleep on the weekends. That's a terrible idea because I think, making up for the week.
Making up for it, you're like, no, you already did the damage.
But what I'm doing is actually disrupting my rhythm a little bit more. So to me, I think I need to try to get a little more during the week and then sleep kind of normal amounts on the weekend rather than doing the feast or famine where you're waking up really early in the weekdays and then binging on the weekend. So as much as you can, try to work it into your routine.
And this is a good time to do it. I know a lot of people right now having resolutions and wanting to be healthier. And these are some great things to learn about. Routine.
That's right. Consistency. Your body loves it.
I'm going to set an alarm in my phone. Thank you very much.
Love it.
Dr. Kohli, make sure you check her out, 9 News. And you can get an appointment too at Cherry Creek Heart.